Hello, everyone, and welcome. We're so glad that you all could join us today for this exciting event hosted by George Mason University's College of Public Health Alumni Board. That is us here. My name is Syreen Goulmamine. I serve currently as the Vice President of the Alumni Board, and we're thrilled to have you all here for our moderated panel discussion on building your public health toolkit. Whether you're a current student, a recent graduate, or a seasoned alum, today's session is designed with you in mind. Thank you also for those of you who are joining outside of our George Mason alum network. We're really excited to see some of our partners and fellow public health colleagues here tonight as well. Our goal is to help you explore the essential skills, tools, and competencies that public health professionals need to thrive in a rapidly evolving field. We'll be hearing from an incredible group of Mason alumni who are making meaningful impacts in diverse areas of public health. And we'll be sharing insights from our own journeys, highlighting the tools that have helped us along the way, the resources that supported our growth, and how we've applied these skills in real-world settings. We aim to give you all practical tips, actionable strategies, and a clearer sense of how to build and strengthen your own public health toolkit, no matter where you are in your career. We'll begin with a moderated panel discussion and then open it up for audience Q&A. So please be sure to drop your questions in the chat as we go. So let's get started by welcoming our panelists. So please introduce yourselves. Maybe we'll start with Vincent. Also mention your position if you have a position on the alumni board and or also when you join the alumni board.
Awesome. Thank you so much, Syreen. And thank you all so much for joining. My name is Vince Pereira. I am currently the president for the Alumni Association board for the College of Public Health. I graduated from Mason in 2014 with my Master of Health Administration, and currently I'm a senior business manager with the National Committee for Quality Assurance, or NCQA. So thanks so much for having me. I hand it over to Cordelia.
Hi, good afternoon, everyone, and happy Friday. My name is Cordelia Cranshaw. I am a licensed clinical social worker. I graduated from George Mason in 2014 from the School of Social Work, and I wear many hats currently. I'm the founder and CEO of Acts of Random Kindness, a DC-based nonprofit that works with youth on life skills, mental health, resources, and capacity building. I am also practicing as a individual therapist and family therapist, and I was named Alumni of the Decade in 2023, and I've been on the Alumni Board since 2019. Thank you all for joining us, and I'll pass it over to Kelly. You're on mute, Kelly.
You're mute.
Sorry about that. Thank you so much for joining us, everyone. I'm happy to be here and share some of my experiences. I am a member of the board. I just joined, so I'm the newbie. But I graduated, I actually graduated from Mason in 2021 with a degree, Master's of Science degree in nutrition. And then I graduated in 2023 with a PhD in health services research. And this was actually my second career. I'm a lawyer by training, although I started practicing law in 2014. And what I am currently doing is I am a nutritionist with the U.S. Department of Agriculture. And just prior to that, I was a postdoctoral research fellow funded by Texas A&M University, but working with the same group that I'm working with now at USDA. And that's it. I'll hand it back to Syreen.
And I'll be kind of serving as a panelist / moderator, maybe more so in the moderator role, but just a quick background about me. I did introduce myself previously, but Syreen Goulmamine, I graduated from Mason in 2023 with a Master's of Public Health. So in the Department of Global and Community Health. And I currently work at the Society for Women's Health Research as a science programs manager, and then do kind of similar to Cordelia, wear a couple of different hats in other spheres and do some fun projects at the Virginia Department of Health. And yeah, so very excited to be here with you all. So before we dive in, I do want to take a moment to thank the rest of my fellow panelists for being here. Your presence speaks volumes about your commitment to growing as public health professionals and supporting our Mason community and the public health community as a whole. And with that, let's shift gears and get into the heart of today's event. So kind of going into that, from government agencies to nonprofit organizations, research to community outreach, our panelists have unique stories and valuable lessons. So I'll direct this first question to Vince to kick it off. What are the top 3 skills that every public health professional should develop to succeed in today's evolving health landscape?
Awesome. So thanks so much for that question. And before I get into it, just to give you some background regarding my bias, I mentioned that I work for NCQA. And so NCQA is a leading accreditation agency for health insurance companies. More than almost, I think, a little more than 90% of all health plans nationwide hold an NCQA accreditation. We're also the stewards of HEDIS, so a HEDIS data measure set. So that's a set of measures that is reported to health plans, or health plans report to NCQA. Hopefully you're familiar with that if you're involved with quality. So my response will be a bit from that perspective. So when I think about 3 kind of core areas, I think about public policy, I think about strategy, and I think about data. So from the public policy end, certainly there's a lot of unknowns on the federal side. However, the state side, public policy, a little more predictable. Of course, public policy is never predictable, but always having the ability of, contextually understanding what the environment is, whether that's at the county level through needs assessment, understanding what the governor has as a priority, any type of initiative, knowing where the dollars are allocated, obviously important. That's obviously an area that is a priority for your state. And of course, it could be population based. It could be based on needs. Really, there's a number of different directions. So public policy, really understanding how to do a qualitative analysis, knowing where the priorities are and how those are prioritized, huge must have. And I believe that's a core factor in the public health area. The second item, so contextually, we know what we're dealing with in the public policy arena. Those quantitative skills, really knowing how to use data to make a story and to really demonstrate return. Constantly, what we hear from health plans, they're always looking to where is the return. And I believe that public health professionals are really best suited to really defining, quantifying, and showing. Here's what you invested. Here's the services you provide. Really think about those economics, and here's what the return was. Here's how you compare to different benchmarks that are published, maybe through like Atlas dashboard or any kind of public open domain that shows public performance across organizations. So again, showing those quantitative skills, here's where the return is. I think that's always a strong suit when you're benchmarking against industry performance. So the quantitative skills core for sure. And the third area, which, I don't know if it's really that core for public health, but certainly something I would think across all professionals, are strategy, understanding what's important to the organization. So we know what's happening at the policy level. We understand how to really manipulate the data and uncover insights, but also what does that mean to the organization? So what are the goals of the organization? Here's their future state, or maybe you would imply that there is a future state, understand where they currently are and being able to draw, deduce what that gap is and kind of what's needed. So if there is a population that is at risk or costly population, certainly high use population, high need population. So your dollars would definitely go further in this area. And by investing dollars in there, you can have a return that's a cost savings to the state, employer, or buyer. So for me, those are the three: data, public policy, and strategy for sure.
Thank you, Vincent, for sharing those. Kelly, Cordelia, do you all feel like there are other skills that you would add to that that people should have with regards to developing to succeed in the health landscape, public health landscape?
Sure. I'll just mention I wholeheartedly agree with what Vince said. I would add a little bit to the data, the sort of the quantitative data aspect, and that is, well, first of all, speaking from my own experience, and I have a very unique experience, but speaking from that experience, I think being aware of potentials for bias, and by bias, I don't mean, I think what sort of the everyday meaning is, bias just means somehow your data is not correct in some way systematically. And so when you're collecting data, when you're looking at data, you need to sort of be aware of the potentials for bias, because if you're not aware of that, then basically the data is not going to be telling you everything it can be. Then the other thing I would just quickly mention is listening skills, being able to listen and being open to new ideas, new experiences that maybe you didn't expect. And I know certainly I had that experience when I was at Mason. I was a graduate research assistant, and we were working with a population I wasn't that familiar with, and I was constantly being surprised and delighted in some respects by things that I was learning that I hadn't otherwise thought from the people that we were helping.
And I will add to that as well, where I thought that some skills that would be useful for you all to apply would be flexibility and resiliency. Because of the landscape and how quickly it's evolving, we have to get to a point where we can be flexible and understanding and adapt to whatever changes are coming our way.
Thank you, guys. For this next question, I think I will direct it towards Kelly, if that's okay. So, how can early career professionals gain practical experience in public health, especially if they don't have direct access to internships or traditional job opportunities? And when we're talking about early career professionals, this can also be especially for people who, similar to yourself, kind of decided to switch careers or maybe have that non-traditional pathway.
Mm-hmm. Well, I guess I would say two things. First of all, just kind of believe in yourself. I have followed a non-traditional path. I've had quite a few people kind of express views that, like, why would I be doing this? Are you sure you want to do this? And so just believe in yourself and follow that voice inside of you that's telling you that this is what you want to do. But then the other thing, more sort of concrete wise, I am where I am today simply because when I was a master's student in nutrition back in 2017, I approached a speaker who was at who spoke in one of our classes, and I asked her if she would take me on as an intern. And I really liked what she spoke about. I thought that the work that she did was fascinating, and I just thought, I'd like to just go find out more about what they do. And she thought my background was amazing, brought me on as an intern, and I use that term loosely because I didn't really do anything. I just really observed. And then fast forward a couple of years ago, she approached me about applying for the postdoctoral research fellow position, which I did. Was working with this group for a year and a half, and then that led to the permanent position. So don't be afraid to go up to people. If they're doing something you find fascinating, just go up and ask them, can I come be an intern? Can I come spend a day just watching what you do? So just be willing to go out there and take that initiative and believe in yourself.
I second that, what Kelly is mentioning in regards to networking. It's so important to get to know people in your field, in your industry, in your community. And another great way to do that is to ask people to go to coffee People love talking about themselves and sharing information. And when you leave with that, they are likely going to inquire about you and what your interests are. And if you can offer that opportunity for them to speak about their experiences, that they essentially become a part of your network.
Yep. Yeah, I second that.
I would also add, I think, with the early career professionals, oftentimes we think, it has to be specifically like a job experience. And I think many of us have alluded to the fact that, introducing yourself to somebody, like talking to them, taking them to coffee, talking to them after a lecture, that's like a really good way to make those connections. Another way to really do that is to like spend time in things that maybe are like extracurriculars that maybe you wouldn't necessarily think have a public health focus, but you can make them a public health focus. There are a lot of organizations like social clubs that maybe you wouldn't necessarily think have that focus. In the DC area, the DMV area, we have organizations like the Junior League, and they have kind of subgroups where there are women who are in the field of science or the field of public health, and you can kind of interact with people who are in that field and kind of socialize and learn more about those fields, and then kind of gather your network in that regard, and learn more, and gather opportunities in that way. So in a social context. And then also if you're looking for, like I said, very practical experience, there are organizations, depending on what specifically you want to do in public health, that you can join either as a student or as a professional, and kind of make it line up with the work that you are currently doing. So those are just a few ways that somebody can, kind of get more engaged as a early career professional. Vince, not to put you on the spot, but I don't know if you had anything else you wanted to add to that point.
Yeah, certainly. Just to kind of build off what Kelly mentioned, and certainly Cordelia, with asking for questions, as a early careers, you have a license to selfishly ask for questions. Ask for all of it. Like, we've all been there. We all get it. It's so important. Don't be bashful. Like, be as far as possible. I'm a graduate student or undergrad student. Here's where I am looking to do that. It's totally acceptable, and so don't hesitate at all. Again, everyone's been there, and it's totally appropriate. And if there's a void there, maybe that's an opportunity of, hey, next month we're looking to get 12 professionals to talk to a group of students, and you kind of self-organize. Maybe it's, depending on where you live, it may be more logistically difficult, but if it's something online, again, be forthcoming. There was a student who reached out to me from GW on LinkedIn. Hey, she wanted to know about an internship. I was like, yeah, absolutely. I'll talk to my folks. She didn't get selected, but it's totally understandable. So building upon that, in addition to being confident, also just, I don't want to say be selfish, but be generous in asking. And also to add, maybe I'm not sure if we'll get into the conversation later, but we live in a very unique time right now where almost like everyone is a content creator. And it's something that I think you can exploit in this day of age. So in building your own personal brand, like Tableau has a like an open source, you can display some of your projects. So if you are in data visualization, data analysis, that can add to your brand and building your portfolio of using some data. Hey, organization X, I see you have some of these data sets. Thought I'd do a quick and dirty for you or whatnot. I wanted to know if you wanted to build upon this. So also invest in your brand, but to Cordelia's point, yeah, the number one thing, networking, self-branding, and just, asking for it all. It's all appropriate.
And can I add, shameless plug, get involved with your alumni board. You can get connected to so many opportunities to stay connected to your university, different events. Obviously, because we are engaged with the alumni board, we have this opportunity to connect and be a resource for you all. So this is also a great way to make sure that you are taking the steps early in your career to ensure that you are connected to a larger network.
Absolutely. Before I go to the next question, if things are percolating, this is for the attendees, if things are percolating, you're like, oh, that's really interesting, that's making me think, please feel free to drop, questions, comments in the chat. When we get to the Q&A section, we'll kind of try to pull those and answer those then. For the third question, what are some of the biggest challenges you faced in your public health career, and how did you overcome them with the skills in your toolkit? Cordelia, would you mind kicking us off?
Certainly. I would have to say for me, as I continue to move up the ladder and have opportunities to get promotions, what was challenging and where I had to find a balance was making sure that I had my ear to the ground. So the further I got away from the populations that I'm serving and the individuals or the families or the communities that I'm working with, making sure that I know, for example, that policy that may be implemented makes sense for what they're experiencing on the ground. So I would encourage you all to make sure that you have that balance of keeping yourself educated, keeping yourself updated on the latest trends and the latest experiences of whatever population that you're working with, and making sure that you always have that balance of making sure that whatever role you're in, it is directly applying to the population that you work with in a positive way.
I'll go next. I think the biggest challenge for me, and I'm still just a couple of years out, and still kind of was in that academic environment in the postdoc position. But so keeping that in mind, I mean, the biggest challenge I face is something I said a moment ago, which is people kind of being negative or naysaying, why are you doing this? I'm ready to retire, or, are you sure you can do this sort of thing? And so I think maybe the benefit I have from having a second career or doing a second career is I know myself and I know what I'm capable of. I know what I like. And so none of that negativity, if you will, kind of influenced me. But I think if you're younger, it might influence you a bit more. So what I would say to those younger folks out there is just, again, believe in yourself and follow the path that's right for you. And don't listen to anyone telling you that, you shouldn't do this. It's not right. If you have some challenges, right now in the as Vince alluded to, there's a lot going on at the federal level, just kind of a lot of uncertainty, a lot of upheaval. Just sort of know that you're on the right path, and then have that resilience that Cordelia talked about, and know that maybe now I might not be able to have the position that I thought I would have, but I think public health is going to come back at the federal level. So reach out to the state and local levels, get that experience. And then when things settle down, when the pendulum swings in the opposite direction again, maybe some of those opportunities you might have been thinking about may come back. So be confident in yourself, have resilience, and be optimistic.
Echoing that just post the kind of thinking about the future of opportunities opening up. The unfortunate consequence about something being drastic one direction is that it propels back, very, I think, harder, when it swings back the other direction. I'm thinking about with COVID, there is just kind of a lack of attention to public health, I think, overall. And then when COVID hit, there was just such a need. The need was huge. I know all my friends who were nurses. They had great opportunities. Certainly the epi folks were just kind of overworked even more with tracking. But it does kind of create this huge splurge, a drastic need that comes back. So to Kelly's point, definitely staying active. Again, local, state, it's still all public health. It's gonna be something meaningful if and whenever something federal starts to come about.
Yeah, I would also say, like, in terms of the biggest challenges that I have personally faced with my public health career, it really has to do a lot more with um, the the shifts, and I think we've all kind of mentioned it to a certain degree, but the thing that has really helped me a lot is continuing to pull skills from the jobs that I have been in. So like while I was a community health worker, for example, working with the populations that I was working with, I was learning from the people that I was, serving essentially. Like, what are your needs? Like, how can I be a better stewardess for you? Like, that was something that that I learned to be a better communicator through that. And so in even in those challenges when there's like a lot of uncertainty, the thing that helped me the most and helped me be a better public health professional was essentially making sure that I was being a better steward, or steward, for the job that I was doing, for the population I was working with, for the research project that I was working on, and pulling out, whatever skill that I needed to for that. So I think that's really the key piece here in that, and I think that's what I'm hearing from the other panelists as well.
Well, let me just add quickly to that. I mean, one of the things I've experienced in my career trajectory is many of the skills you learn in one job are transferable to another job. So, for example, all of the writing skills, the analysis skills that I learned as a lawyer were 100% transferable to my career, if you will, as a student again. And now they're transferable to the job that I'm doing now. So again, if you're not doing the job that you necessarily thought you would be doing or want to be doing, still focus on it, develop those skills, because those can be transferred to another job down the road.
Absolutely.
Yeah, and I would add to that, and I think, Kelly, you have been sharing your experiences where you pivoted from one career to another, but the foundation of that was your skill set. Never be afraid to pivot if you need to pivot. If you find that you are burnt out, or you're not as excited or energized, or you just want to tap into another area to fulfill your passion or purpose, do that. Never be afraid to pivot at any point in your career, because as Kelly has explained and shared her experiences, you can apply those same skills.
Thank you, guys. Kind of moving from that, what leadership skills are most important in public health? And how can emerging professionals cultivate those leadership qualities?
I can share. I thought about creativity when I thought about this question. I think it's really important for us to be creative in how we imagine a more, let's say, just world for our communities and our families and those that we serve. And I have incubated an organization called Imagination Factory, and it really works with professionals in our field to tap into that creativity. If you look at society and how it shapes us in regards to education, a lot of times that creativity is put into a box and put away. And we can begin to use that creativity to look at how we serve and how we develop not just ourselves, but the work that we're doing. So I encourage you all to get creative and to do things that stimulate that creativity, so that you can continue to be fulfilled in your professions.
Mm-hmm. Well, I'll piggyback on that a little bit, and that is be able and be willing to think outside of the box. Because one of the things that I have observed in my two careers is that, you get going on a path and everybody's doing the same thing, and you sort of develop blinders. And similarly, one of the things I saw in academia is, and also in my professional life as a lawyer, there's something we always refer to as silos. And so be willing to be open, rather, to interdisciplinary approaches. And so, epidemiologists may do something a certain way, but health services researchers may do something a different way, and be curious about, reaching out to these other fields and think, well, how did they solve that problem? Maybe I can benefit from that, and collaborate if you can. So just be willing to kind of think outside of the box. And I've always believed in interdisciplinary approaches. You can always learn from other fields, and perhaps solve problems, or find a new way to solve a problem that we haven't been very successful in solving in a particular field.
Agree. And thinking about leadership skills, I love what Kelly mentioned earlier in the discussion in terms of listening. I think a huge piece of being very influential, we think about leadership, we think about being influential. And so if people don't feel like they're being listened to, they're not going to listen. So investing the time to, whether it's peers, folks in your community, who's ever in your scope of influence, having people to really recognize that you are listening to that feedback, I think is the first step of really engaging them and kind of demonstrating those leadership skills in whichever role that you're looking to take on. So, Syreen, I didn't know if you want to comment on the leadership, but I also wanted to, I see Dia was in the chat. So whenever we're ready, I wanted to talk with Dia.
Yeah, if you want to engage, then that's also, it's a moderated discussion, so you can do that.
Perfect.
Yeah.
So thanks so much for jumping in the chat again. Open discussion, open dialogue. We can probably transition to our open dialogue if folks have comments and questions. So thanks for kicking us off. I see that Dia acknowledged that she has a similar background as Kelly, kind of a career change. And so first thing that popped in my mind, film production, communications is huge in public health. So it definitely seems like that's an early step. It says my current job as a dispatcher is the closest I'm getting to public health. Yeah. So, I don't know what jumped out to the panel in terms of the intersection of film and public health, but of course, for me, as communications, I think there's a matter of storytelling. Often,
Mm-hmm.
oftentimes there are, we call them vulnerable populations, they're populations at risk, and a part that they're vulnerable is that providers, or for whatever reasons health systems have kind of overlooked that. And so in storytelling, even with data, you can't just throw data in front of folks. Making it real, making it practical, making it make sense. Here's why it's important. So if it's a disabled population, really telling a story about the disabled population and how there's a return of investing into this group. My wife and I, we help seniors and also those who are disabled with self-employment. Since working remote is so common, why aren't we investing in so folks can have their self-employment? When you improve someone's, personal, their personal competence, they're more engaged. They're more likely to adhere to, any type of medical guidance. So storytelling, I don't think you can't get enough of it. What pops out to me, really vulnerable populations, telling a story about who's being overlooked. I think that can definitely be a huge differentiator. And with 20 years in film, I mean, it almost seems like that's a market niche that you could create if it's not already there.
Well, and let me add to that. I don't know what your background, I'm sorry, I don't know what you're currently studying, but what pops out, or what occurs to me, especially based upon what Vince has said, is qualitative research is something that might really appeal to you. Qualitative research is about collecting data, but the data is actually in the form of words, or in the form of pictures. They're in the form of things other than numbers. And so, and the challenge with qualitative data is finding the narrative, the stories that are buried in those words. And so that might be something that you might find quite appealing. And we need lots of good qualitative researchers. Speaking from somebody who did a qualitative research project for my master's thesis.
I see there's another question here. Are there any tools, platforms, or certifications you wish you had invested in earlier in your careers that made a big difference in your impact? Not sure if anybody
I can
wants to
jump
take
in
that.
and give some insight on how I would answer that question. I think two things come to mind. One is with technology soaring at the speed that it is, being very educated and aware of how that can impact your job, your position, your role, and those that we serve. AI seems to be the top of the future for technology. So be aware of it, be educated on that. I think the second thing is writing, knowing how to write and produce that information, because those are things that can be published and put out there, and it stays out there, but it also can help you conceptualize your thoughts and your expertise, and people will begin to read those things and naturally give you credit for your expertise because they've been able to visualize and read and understand the work that you do. And I think that is really compelling to the public health sector.
I'll add to that. I absolutely agree with the writing aspect. That is just critical. And so take every opportunity you can to continue to improve writing. I mean, even um, I'm still working on improving my writing. So it is kind of a lifelong pursuit. But the other thing I would add is all of the sort of the technological tools that are available. So again, just speaking from the standpoint of a health services research person, there's different statistical software that I have used, and so I have learned Stata, I have learned some R, I have learned SAS, I have learned the other one I'm forgetting, but in any event, I've taken a class on AI, and my mind was just blown by AI, both in terms of what it can do and also in terms of how wrong it can be. And so the point is there's a lot of tools out there. I heard somebody mention Tableau in this. There's something, I'm again blanking on it, but in qualitative research, there's a specific kind of software that's used. So especially while you're a student, take advantage of learning those opportunities. At Mason, the library has a lab where they have people who can help you with all of these software tools. Maybe in your job, you might have an opportunity to take a training class. SQL, for example, Python. I mean, the list is endless. And so take advantage of the opportunities both at Mason and outside of Mason to learn and become proficient in these tools, because they're used everywhere. They're just used everywhere.
Yeah, I would agree with a lot of the research related tools, like making sure you practice your writing and continue to write. That is something that will always, I think, be valuable. Um, and then I'm an epidemiologist by trade, so R is a free tool. Even after you've left university, you have that accessible to you. You can download it, and there's a lot of resources online and guided tools to help you practice new things and skills and how to use it. And so that's definitely something you can exercise. But the other thing I would say too, in terms of like tools or like platforms, um, they're I would consider also the soft skills. I know we always talk about like what certifications look nice and what like things that you want to like invest in. I also think about like trainings that are like about your communication and like how to give a good talk or like a good speech or things like that, because that also goes a very long way. um, you know Depending on obviously what kind of work you want to be doing, sometimes those skills also will translate, and so those are things that I wish I had spent more time doing earlier on, like in during school or like in my career. I did give a lot of presentations, but not to the same same level that I thought I would be doing as I am now. And so also thinking about those skills the softer skills maybe that you're not thinking about, in the long run. Um, Vince, I don't know if you want to add anything.
Yeah, agreeing really with what's being said, and just want to really nail home the point that you're making with soft skills. So I think for like a certification, one or two that's most relevant to you, face value or whatnot, just to demonstrate that you are actively someone who's a lifelong learner or really dedicated to a profession. I think you can find that out within whatever area that's most meaningful to you. But to Syreen's point, the differentiator is noticeable when you interact from person to person. How they're able to communicate a thought is huge. You can hear the same information from two different people, but depending on the delivery, how you're able to break it down, you're really going to stick out and stick to a person. So the other thing about like software or switching to software is that I use this analogy when I was speaking with someone earlier this week, but if you want to build a shed, there's learning how to build a shed and there's like learning how to use the tools. Learning how to use the tools won't teach you how to build the shed. So it's like important for you to understand what actually goes into building a shed in this analogy. So I know folks like it makes sense to pursue like the project management professional certification, the PMP, great for demonstrating project management skills, but simply learning how to use like project management software, it won't teach you things like dependencies, in a work plan. It won't teach you those measures of earned value. So I had a great mentor early when I started NCQAs. To really yield meaningful results, you need to have a deep knowledge of whatever area you're working in. So again, the certification should reflect your knowledge of that. But I think employers have come to a place where they're not too, I don't think folks are as too impressed with certifications now as they were in the past, especially with tools that are always evolving. You can kind of jump in and learn. If you learn how to play use R and statistics, I don't think anyone's going to criticize you for not having like a PhD in that if you really know what you're doing. So take that time to invest in understanding the area in depth, and also again that those communication skills. The better you get at it, the more of a reputation you can build with your colleagues.
But let me add to that. I mean, I agree with everything that's been said. And one of the things that I saw when I was at Mason is people not taking advantage as much as they could of the tools and resources available at Mason to help you develop these skills. So as I mentioned, if you're into statistics and you want to learn or you need to know certain statistical software, there's this lab in the library. And there were periods of time when I was working on my PhD that I practically lived there. And I got to know one of the people who works there who's just absolutely wonderful. And she just really helped me. And I didn't really know that many of my other fellow students who were utilizing those tools. So Mason has tools that can help you develop and grow in some of these things that we're talking about. So be sure to reach out, explore. There may be things I'm not aware of that are out there now. So talk to the professors in your program, talk to the admins in your program, talk to other students, and avail yourself of the resources that Mason can make available to you free of charge while you're a student.
Emphasizing that free of charge.
Exactly.
And maybe this is also for the other panelists. What would you say in terms of maybe, a couple years out after you've graduated, how do you go about finding resources to continue your professional development?
I love conferences. I think those are always a great way to combine education with networking. So find some interesting opportunities out there where you can travel, attend conferences, meet people, not just in your local community, but nationwide.
Mm-hmm. Right.
Absolutely. Can to that point, you get best of both worlds. But even if you're not able to formally attend a conference, and this may be again, if you're up for it, I live right now near Orlando, and one thing that I did as a student If I wasn't able to go to every conference, there's always a conference in Orlando. So I think in the DMV, it's pretty common to see a conference. If you know a conference is coming up and there's a networking event, typically it's like in the evening of day one or day two, go to that. Just being in the environment, being a familiar face is huge. So be strategic, even if you can't formally attend. But yeah, certainly if you're attending, it's a great way of understanding what are the most pressing items, and connecting with speakers are great as well. They typically, those who speak are folks who are really involved in the industry. So they're great people to connect with. Maybe they're interested in publishing papers or doing some type of program administration, targeting speakers. Even if you're going to a conference, I highly recommend contacting them before. So check out the agenda, comb through that, get some names. Hey, looking forward to your session. So when they see you in person, it's like a friendly touch.
Okay.
There's a few other questions in the chat, so I'll just quickly touch on them. And if our panelists have an answer, we'll just quickly answer them. So Olivia asks, do you recommend any certificates that would boost a student's skills who is about to graduate with their Masters of Public Health, and or what resources would you suggest to stand out in a job specifically related to quality assurance? I think this is more of a Vince question. Unless the other panelists have an answer.
See, Vince, you're muted.
That's the last one. What is one innovation or gap in public health?
No, the related to quality assurance. If there's any resources or ways to stand out in a job specifically related to quality assurance, a graduating Masters of Public Health student.
Okay, awesome. So NHQ is still the kind of industry go-to for healthcare quality. I wouldn't just limit it to that, but the great thing about associations um, and think tanks or research hubs is that they typically have like a framework. So I would even organize like your resume around that framework. So I think public health has like 10 areas or whatnot. So from that stance, understanding like which area, what's like my top three strengths or what I'm really interested in, using that as an outline for like your resume, highlighting that, digging into that, searching to see what has been published. So seeing what's in the journal. So usually in the journal, you can see kind of what's the buzz going around that topic or that area. Um, digging into, I think you can learn a lot by looking at the methodology of a study. That kind of tells you what you need to know. So certainly abstract gives you a good understanding of what it is. But finding, you may have heard folks say, what's at the intersection of your talent, treasures, and time. Is really what you're going to enjoy doing. So find what's of interest, what your strengths are, and what the industry is talking about is going to be huge. So healthcare quality, again, there's different angles. I think there has been a huge appreciation for data, and honestly, organizations still are struggling with knowing how to really use data in a responsible way. Data should enable performance measurements, and we need to measure performance in order to claim whether or not we're actually improving anything. So pulling back again on those quantitative skills, measure development, knowing how to create measures, um, that's really going to be a great basis if you're interested in quality. And also understanding if there's a service line or population, there's so many different measures that are specific to a service line and also specific to a population. So drilling into that intersection. So if it's geriatric and post discharge, maybe it's anything with women's health and preventer services, there's probably a set of key performance indicators, KPIs, or some really measures that are pressing. So look for measures that are of interest, dive into the methodology of any area that makes sense, and definitely think about your career in terms of how the framework of whatever the industry is outlining that.
Yeah, awesome. This one I'll direct to Cordelia. Madison asks, I'll be a postpartum tech this summer, and I just want to know any tips or tools to help me. I'm a freshman at Mason studying nursing, so this is my first job related to my major. So any tips or tools for our freshmen studying nursing?
I would say a tip or tool that is always important to keep in mind is self-care and creating that balance for yourself as you are jumping out and eager to hit the ground running in your career. You just want to be mindful of creating a good work-life balance so that you can continue to be sustainable in your career. The work that we do and working with others can be very demanding. We can work in crisis-driven environments, environments where we may be exposed to secondary trauma. So you just want to be very mindful of taking care of yourself as you're getting out there in the field. And it's a really good reminder to start that early on so that your career can be as sustainable as possible.
And this one, I'll leave it open for all. What is one innovation or gap in public health to which emerging professionals should pay more attention? I know there was a lot of emphasis on technology, specifically AI, but are there other areas that stand out to you guys? So anybody, if they feel
This question I thought was interesting, and what came to mind was creative financing. So understanding how we can start to use the dollars and the monies that is available to us in creative ways. A lot of times the money and the dollars already are already allocated for certain areas or programming. And I think if we can get together as a profession and begin to think of creative ways to really use the dollars that are available to us, it'll continue to make sure that we are innovative in all that we do in public health.
Vince, Kelly, either of you have seen any trends or things that stand out in public health?
Well, one thing I remember hearing a lot about when I was in my program at Mason, it's not so much relevant to what I'm doing now, but it really spoke to me. And it was this idea of how to kind of scale up research findings and apply them to a larger group of people. So oftentimes when we do research, we have a very small sample for one reason or another. And maybe we're doing an intervention and we want to see if something we do can help people eat more healthily. But we might have great results, but then the challenge becomes, well, how do we apply these techniques that we found to be successful in a small population, in a uniform population, homogeneous population? How do we apply these findings to a much larger group of people, which may or may not be as homogeneous? And so I think maybe that's something to be thinking about. And I think that in sort of the research world, especially when when you're applying for dollars, I think many research grant applications are requiring, at least this is what I heard, are requiring you to sort of address that issue. So it's great if your project works well with a small group of people, but that's a small group of people. And so you want to be thinking about how to scale your research findings up to a larger group of people.
Anyone else? I would also add that I've seen a lot in terms of topic area. And this is also by nature of the work that I do, being in women's health, but that a lot of state health departments have put a much larger emphasis on maternal health in the last, I'd say, 5 years. So topic area wise, maternal health is very big. And then, because I'm in women's health, I'm always going to be making a plug for women's health. It made a lot of moves in terms of getting more emphasis in the last administration, particularly with the Women's Health Initiative that the White House had signed. But I'm not really sure about this next administration. So we're hoping, for some moves in that direction as well. But regardless, I do think that if there's a population that is of particular interest to you that you want to continue to do work with, that there are probably organizations doing that work, and there's probably a spot that you can fill, whether that's in a research capacity, a programmatic capacity. So just kind of thinking about that and where you might fit in when you're developing the skills to contribute in public health. And I think we'll do one last question here. What are some jobs that someone majoring in community health can go into? And also, do you have any advice for someone who enjoys health but is not really sure what they want to do?
I would recommend working for, Syreen, like you mentioned, a state department or a local community health organization where you can bounce around and be under the same organization but in different roles at different times, to really just expose yourself to until you have identified your interests or something that you're most passionate about.
Mm-hmm. I would say, I mean, I didn't major in community health. It was, more of a nutrition focus, and I don't know where you are at Mason, if you're still taking classes, if you're about to graduate, but if you're still taking classes, I would say be a sponge. Take, to the extent you have choices in the classes you take things where you might be able to learn about areas that you aren't familiar with, talk to your professor, really dig into the projects that you're doing, because I think many times people take a class. I know this has happened to me. I take a class I wasn't expecting to find it interesting, but all of a sudden there was something really fascinating that I found and really sort of stimulated a direction that I went in. So if you have time at Mason, really sort of explore the offerings in the classwork and the teachers, the professors who are teaching you, so that maybe you'll find something that really speaks to you.
Awesome. And I think we're coming close to time. So with that, I want to thank everyone so much for joining us today for building your public health toolkit. A huge thank you for the rest of our incredible panelists for sharing your time, your experiences, and wisdom. It's been incredible and inspiring to hear how much each of you have navigated your public health journeys and leveraged different tools and skills to grow, lead, and make meaningful impact in your communities. As we close, we encourage you all to stay connected, reach out to our panelists, follow up with any questions, and continue to engage with the Mason Public Health community. And thank you again for being here. We wish you all the best on your public health journey. Thank you.
Thank you.
Thank you, Syreen. Bye-bye.